times like this of all the things you hear on social media and different organizations. Some of the things that are more precious sometimes when you're the governor that somebody reaches out to you. But I do want to show you a little get well card I got this morning here at the mansion from a young lady in Lynn, Missouri named Lily. And I just want to tell her how much I appreciate sending me a card, give me a little spring in my step today to start today off. So Lily, thank you very much for the get well card. And I'm doing fine because you sent me that card. I feel much better today. To start, I would like to give everybody a quick update on myself and the First Lady. As you can see, I'm still working here from the governor's mansion. I'm feeling good and still have no symptoms. Teresa is still at home in Bolivar. She is doing very well and no longer having symptoms. So we're very thankful for that. To be cautious, we will remain isolated through the remainder of this week. We both plan on being back to a normal schedule on Monday. Teresa and I are so grateful that we are two of over 100,000 plus Missourians who have recovered. And we are thankful to everyone for their thoughts and their prayers. We are humbled every day to be surrounded by such great people across the state, and we appreciate you all. I also want to thank all of our healthcare workers, county health departments, and everyone on the front lines for all you've done and continue to do. We wouldn't be where we are today without your efforts. They have been out on the front lines for over 7 months now, and it is important for the public to understand how fatigued and stressed they are. For all those people who've been on the front lines, all those healthcare workers for almost 7 months, and we're going to continue to have to be on the front lines for months to come. We must do everything we can to support them, which includes social distancing, wearing a mask, and washing your hands. We have been getting a lot of questions about the annual Fall Festival, which was scheduled for this Saturday. Out of abundance of caution, we have announced yesterday that the festival will be postponed. We feel this is the best decision at this time, given the current circumstances. However, we still want to give Missourians an opportunity to safely celebrate the fall season and with their families at the People's House. So we are looking at combining the Fall Festival with our Halloween event. These events will be outdoors, masks will be available, and social distancing will be followed. We will be sharing more details as we get closer and look forward to seeing everyone soon. On the COVID-19, we continue to work hard and push forward. We are taking a balanced approach and continue to go back to our 4 essential pillars: testing, PPE, hospital capacity, and data. I want to reassure everyone that all 4 of these pillars are stable. We monitor this every day, and we are constantly working to improve. The fight is not over, but we are on the right track, and we will get through this. As far as COVID-19 testing, we recently reached a new peak for PCR testing with over 122,000 tests during the week of September the 14th. And this is great news, and we will continue working to increase our testing numbers across the state. As you know, in August, the FDA approved a new saliva-based COVID-19 test developed by researchers at Washington University in St. Louis. This test is a major development in COVID-19 testing technology that will help us expand laboratory capacity and testing volumes even more. In addition to the testing machine that will housed at WashU, the state purchased 4 additional testing machines, which we'll be distributing using a regional-based approach. Right now, we are looking at placing these machines in Southwest Missouri region, the Southeast Missouri region, the Central Missouri region, and the Kansas City region. This is a very technical piece of equipment that will require proper infrastructure and trained personnel in order to operate. So we are having conversations as we speak to start the process and deploy this technology as quickly as possible. As I mentioned in the briefing a couple of weeks ago, the federal government has purchased 150 million Abbott Rapid Point-of-Care tests to be distributed to the states. We expect to receive 120,000 of these tests in Missouri by the end of this week, and nearly 2 million by the end of the year. Progress also continues with COVID-19 vaccine. Missouri was awarded $3.2 million from the CDC for planning and implementation, and a multi-agency support team has been working on a distribution plan since the end of August. We have 6 lines of effort designed around CDC's playbook, from logistics to community engagement. We believe we are ahead of other states in planning. Other states are looking to our plan as a model, so we are very proud of that. I want to thank everyone involved for working so hard to get a plan together, including our support team from the Missouri National Guard. Although there are still many unknowns about a vaccine, we remain optimistic and are prepared to take action as soon as there is a vaccine available. As you may have seen on Monday, we also now announced the expansion of our state COVID-19 dashboard. Throughout COVID-19, we have worked hard to be as transparent as possible and provide our citizens with the most accurate and up-to-date information. These new dashboards build on our data essential pillar, provide Missourians with multiple charts, maps, and measures about COVID-19 and its impact on the state of Missouri. This includes public health data, economic data, social impact data that will help local leaders, employers, schools, businesses, and citizens across the state better understand COVID-19 in their communities going forward. These dashboards were a cross-department effort with data from several state agencies as well as many other stakeholders across the state, such as the Missouri Hospital Association, the education community, infectious disease doctors, local leaders, and many others. I want to thank everyone involved in their efforts in creating these dashboards. This is a huge part of our COVID-19 response and recovery, and I encourage all Missourians to utilize this dashboards to stay informed and to up-to-date to the situation here in Missouri. This is a great resource to get the whole picture and not rely on other sources that often just reports bits and pieces. On the economic front, we continue to make great progress in our recovery efforts. From February to April, Missouri lost nearly 346,000 jobs to COVID-19, a decline of 12%. We have now recovered over 200,000 of those jobs, and only 11 states have recovered more jobs than Missouri, putting us at 12th in the nation. Consumer spending has also had a strong rebound. Currently, we are up 6.2% customer spending that has been at or above pre-COVID levels since late August. These numbers are very encouraging, and we will continue to do everything we can to rebuild our economy and help Missouri families, businesses, and communities recover from this crisis. It's been a busy week so far, with several conference calls and virtual events. Yesterday, I had the opportunity to speak to a large group of women during the Women's Foundation annual event, which was virtual this year, along with Kansas Governor Laura Kelly. We discussed challenges facing women today and how we can better advocate for women in the workforce, economically, and civically. I've also had several calls with state and local leaders, county commissioners, and mayors. We are continuing to work hard for the state of Missouri, and I look forward to being back soon. Again, I cannot emphasize the importance of social distancing, wearing a mask, and washing your hands. This is truly the best defense we have against COVID-19. If you are sick or experience symptoms, contact your doctor and take the necessary steps to protect yourself and others. We have all had a part in this, and we must continue to be proactive in our efforts as we move forward. I look forward to talking to everyone again soon. Thank you, and God bless. All right, because I'm kind of a one-man show today, so I get to do my own press briefing today. So some of the media has sent in some questions, and I'm going to read the questions off, and I'll answer them as we go forward. I'm going to take a couple of questions, and we'll just kind of move forward from there. One of the questions that come in today, and these are questions compiled with a lot of the media outlets were asking the same question, so we just tried to combine some of them. The Department of Social Services Children Division has now had 6 directors in the past 7 years. With David Wood resigning, what is your plan to bring stability to that division? Well, first of all, I wasn't here 7 years ago in this position, so I'm not sure about all the directors before that. I know that we have a deputy director over there that's done a great job and has since I become governor. We were looking to fill that slot, and we'll continue to fill that slot with the best qualified person we can. Because there's one thing for sure, as a parent, as a grandparent, we need to take care of the children of this state. And we'll get somebody in that place as soon as we can. And we're going to get the best qualified person to be in that position. The next question is, how close are you to calling lawmakers back to the Capitol to take action on a COVID-19 liability packages for businesses? And will that be before or after the election? Well, number one, if we're going to have a liability issue, we're going to bring people back to deal with COVID-19, which I think we should. I think that's very important moving forward. It's going to take the House of Representatives and the Senate to have a plan in place to be able to execute that in a very timely manner if we are to call people back in here to do this. I think the other thing that we got probably facing us more in the near future will be a supplemental that we're going to have in place somewhere between probably now and November at some point, simply to make sure if we do get more federal money that we have the ability to use that money when it gets here. So those are the two things facing doing a supplemental budget. Again, both of those are somewhat unknown on timing. Again, we're working with the legislators every day to try to come up with solutions to that. The third question is, to me, what have you learned about COVID-19 that you didn't know before you were infected? I think this is the thing we all learn in life. A lot of times it's the same things I learned when I had open heart surgery. You know, you always think that's going to happen to somebody else, and all of a sudden it happens to you, and then you're in that situation, you have to deal with it. I think one that I guess I feel like is that you have to understand it, which we did before. We knew what actions to take, which we did, and life goes on. You have to deal with these situations when they come up. Again, me and Teresa are both very thankful. We're one of the people that can stand up here and we can talk about that, along with hundreds of thousands of other people in this state that has went through this process. But look, that doesn't mean there's not people out there every day that there are serious consequences and are much more vulnerable than what me and Teresa were. But the idea of it is you have to deal with it and you have to keep moving forward. You have to do everything you can to protect other people. And we're going to continue to do that. And we've done that from day one. And you know, what you learn from it is you take the right actions of what you're supposed to do and you commit to that. And that's what we're doing, and we look forward to being back into the workforce in the very near future. So with that, thanks everybody for listening today. Appreciate it very much. Take care. Again, you know, take the responsibility. We're all in this together, and we all got to work hard each day to protect one another. And again, I appreciate everybody listening today. Thank you.